Hello, this is Dr. Robert Bates at the Leominster Chiropractic Spine and Injury Center. Today we're going to discuss back pain fairly specifically. First of all, a little bit about myself. I am a 1978 graduate biology major in the pre-med program at Clark University, a 1985 Palmer College of Chiropractic magna cum laude graduate, a 1989 neurodiplomate graduate from the Carrick Institute, and I have taken many other courses over the years, and over the last 3 years have finished a one-year fellowship in vestibular rehabilitation, as well as a one-year fellowship in mild traumatic brain injury. I have written several books and many articles and read the research pretty much on a daily basis. I am also the co-owner and developer of Ocular Integration Systems that designs web-based applications to help people with post-concussive syndrome. So without further ado, let's get into this little back pain lecture. First of all, what is low back pain? That is a general term which doesn't mean much other than your back hurts. And sadly, many of the patients I have treated come into the office and have a diagnosis of low back pain, which tells you right away that someone did not know the real reason for their back pain. And of course, they are never diagnosed and they are on pain medication and anti-inflammatory medication, which is terrific to give them some relief. But if the flare-up calms down, it has done nothing whatsoever to change the disability or the abnormality of function that they have. And of course, they have another flare-up usually. And then, of course, they're having the side effects from these medications. So there are many types of low back pain. Any tissue in your low back that has pain fiber that can be irritated can cause you low back pain. You can have an abnormality because of scoliosis, which predisposes you to pain because of offloading and abnormality of muscle function. You can have various types of congenital distortions with bone formation and the tipping of the sacrum and abnormal sacroiliac joints. All of these will cause some type of dysfunction. You may also have the largest type of back pain, most common is a facet syndrome or posterior joint pain. And there are other things that cause more or less of the facet or posterior joint pain, being a change in lordosis or curve in your low back where the joints are jammed together, a problem with Bastrop syndrome where the spinuses are enlarged and they're rubbing on ligaments that are pain sensitive. You can have enlarged arthritic facet joints which become irritated more easily. You can have a type of discogenic pain, and a lot of people don't realize that the back of the disc has pain fiber, and you might not have a herniation, you might not have leg symptoms, but you can have aching low back pain caused by discogenic reasons. You can also have a torn ligament or a ligament that's irritated. 3 of the 9 ligaments that hold bone to bone are pain sensitive and can hurt. You can also have muscle pain because of prolonged contraction, and if a muscle stays in reflexogenic spasm, it becomes shortened, weakened, and fibrotic. It's another reason why you want to really get to the bottom of the dysfunction so you don't have chronic anatomical change in tissues. So what is really needed to diagnose you specifically and to treat you specifically so that you can get rid of your back pain? You need to have a very thorough orthoneuro exam by someone who has had a lot of experience, is well trained, and knows what to look for so they can have a specific diagnosis. You need to see if joints are hypo or hypermobile. Do you need some stabilization or do you need manipulation to increase motion? No one seems to look at all of these problems, no matter what their specialty is. And that's why most people continue with their back pain and never get resolvement. You also need to look at muscle strengths. The newest literature shows that 90% of the stability of your low back is muscle. You need to have the proper strength. You need to have the proper endurance of slow twitch fiber. You also need to have the proper firing ratios and the proper flexion extension ratios. We check all of this at my office, and it should always be checked, but usually is not. There are also other things that we can get into concerning more pain versus the same type of tissue distortion. If you have a leaky gut syndrome, if you are pro-inflammatory because of diet, then these things need to be addressed as well. At my office, we perform infrared red light laser, we perform interferential therapy, ultrasound, many types of therapy. We have vibratory plate, which we use to bring back the core musculature at a faster rate. And we give the patient a lot of things that they should avoid depending on what tissues they are having a problem with. So if you really want to get to the bottom of your low back pain, the real cause, so you can treat it specifically and get rid of it in most instances, then give me a call, Leominster Chiropractic Spine and Injury Center, and we'll be happy to lead you in the right direction. Have a great day.